Hello, everybody. Welcome to the Health System Fix podcast. My name is Dr. Gaurav Mishra. I'm a child, adolescent, and adult psychiatrist and a health system design student and fixer. My goal with this podcast is to talk to people who have deep understanding of gaps in our health system and are working on innovative solutions. I do believe that hearing from diverse voices will help us find better solutions to serve our communities and healthcare workers. I hope you enjoyed the discussion. Thank you. Hello, good evening, everybody. I know it's good morning in India. Welcome to the Health System Fix podcast. My name is Dr. Gaurav Mishra. I'm a child, adolescent, and adult psychiatrist and a health system expert. I'm excited to welcome Mr. Jolly Pynadath today, who's the founder of EaseDementia, which is a Forbes India recognized organization based in Kochi, Kerala, in India, and supports individuals and families through dementia-focused services, active aging initiatives, and neurocognitive clinical services. Thank you so much for joining us. Great. So I'm really excited to talk to you. I'm trying to understand the dementia care space better. So you can tell us a little bit about your journey, early life. Where did you grow up?
Sure. So basically, I'm born and brought up in Cochin and started my career with some of the best US companies. In fact, I hardly had any background, from dementia side, but I spent my time with manufacturing companies like PepsiCo and Tyco. Then later, I moved to retail. During my last assignment, just starting the startup, I spent my time with Flipkart as an head for one of its division called City Logistics in India. Then on a fine moment, when I thought of doing something to create an impact to the society and the people, kickstarted the journey with startup, and that was into a dementia segment.
I grew up in India, did my medical school in India, but I've been here close to 20 years now in the US. People who are moving from other industries to healthcare find healthcare is a whole another ball game, trying to figure out healthcare policy and everything. How was that transition for you?
The journey was amazing for the last 3 years after starting his dementia. However, from a challenging perspective, for me, it was not that much. In fact, why? Because when I deep dive into what I'm handling, especially revolving around dementia, I think the solves are very limited from a patient perspective and even from a family perspective. When we did the deep research, I think there are a lot of gaps in the ecosystem. So we thought of finding solves and helping the clinicians, the larger stakeholders like hospital managements, and of course the patients and the family ecosystem. So while we created our six bucket approach, which is a non-pharmacological intervention model, after doing deep research on complete guidelines shared by WHO or even the best practices from Mayo Clinic or even some of the healthcare best practices in Scandinavian countries, we developed a model which is completely Indianized to support the culture of India and of course the people of India, which doctors are really recognized in the initial stage, and that gives a lot of confidence to scale.
Right. You mentioned something that which I try to focus on is that when you're trying to fix a healthcare problem, our obvious customer or person we want to help is the patient and family. But a lot of times the gaps we see in rest of the health system, the hospital system, the healthcare workers, all of them have a lot of gaps in how they are able to do the work. So what are some of the gaps you saw there when you're thinking about addressing the system itself?
For the system itself, I think in India, when we talk about India, the population is huge, and but at the same time, what I realized is the healthcare system is much better than other countries. In fact, I don't have much travel experience to Europe or US and all, but through my friends or families, who were working in that location, they mentioned that I think it's very difficult to find a doctor or to get a doctor in US or even in Europe. But that case, I think in India, within if we decided to go to an hospital, it's very much accessible. System is accessible, but however, from a dementia perspective, the solves are very limited. Why? Because I think that's across the globe, the challenges there, because the medicinal solves are very limited. At the same time, it's a progressive disorder, and that is adding a lot of challenge to the entire family ecosystem. It's not only to the patient, but to the family members, especially the caregivers as well. So there, we could find a lot of gaps. So we thought of like how do we solve these gaps even from a doctor perspective. I think doctor doesn't have much time like to give psychoeducation to the family member, because the biggest challenge, like if somebody got demented in a family, I think the caregiver like will be having like huge burnout. They doesn't know how to navigate the patient, right? So there we could see that challenge, and we passionately deep dive to figure out some solves to support both caregivers and the patient.
You're absolutely right. I think some of the, especially in areas which of chronic illness like dementia and other chronic illnesses, which have so many social aspects to the person's health, a doctor at times can not do too much in their session, and there's a lot of other supports that are needed for somebody to do well. You studied several different models and then adapted them to India. Can you give me some examples of some things that you've adapted to India and how that's differently done with your work versus what's maybe done in Scandinavia or elsewhere?
So, for as far as dementia is concerned, especially like the WHO guidelines says, non-pharmacological intervention model definitely helps to improve the patient's cognitive journey as well as their quality of life. So what we did is like we had gone through all the best practices, like what they recommended, and we formulated a model based on the culture of India, the needs of the people, and the acceptance level of the people, right? So we developed that six bucket approach. I can mention that six bucket approach in detail, which is focusing on cognitive stimulation, activities of daily living, social interaction, emotional well-being, physical exercise, and psychoeducation for the family member. Out of the six bucket, we focus one bucket specifically for the family members to support how to navigate the patient's journey, and adding as a caregiver like how they can support to stimulate their cognitive journey as well as their quality of life.
Right. That's amazing. I think this is, when I was looking at your website, this is what attracted me because I've worked with several patients with dementia, and what I've seen is all the different buckets you mentioned, none of which, as a doctor, it also, when I work with my patients, I realize none of these buckets, which actually help our patients and families, include medication or
Yeah,
even
correct,
diagnosis, right?
correct.
Which in medical school, all you are taught, unfortunately, is that you know everything, which you don't. And you can also not do all the things that are needed, and these six buckets are hugely impactful. Sounds like you have dedicated teams which are working on each of these very specific areas. Is that correct?
So we have a research and development wing. In fact, like so we are a startup. So current workforce is around like 50 people right now, spreading across all the locations. But however, in our the R&D facility, like which we opened an small office in Kochi Metro's one of the metro station. We opened a neurocognitive clinic and a research and development center. There are multidisciplinary team. In fact, focusing on all these areas. They feed the ground team. The ground team are intervention specialists, like who are maybe either like from psychology or medical and psychiatry postgraduate talent who trained in our six bucket approach, and they deliver the sessions with the patients. That's how our model works. Because one of the other challenges I think many of the family members are facing during my early research, what I find out, even for the families, like to take the demented patients to the doctors, that is also a challenge, because while during the journey I think like they may be having, and while they reach hospital I think they may need to wait for a long time to consult the doctor. Even though healthcare ecosystem is good in India, we can access the doctors, but they may need to wait. It's maybe at least like 1 hour, 1.5 hour minimum, right? So all this challenges like adding pressure to the family members. So we thought of like we need to ensure support at home, right, rather than coming to the hospital. The entire ecosystem should reach home, so that the patient's journey will be better, and even the family's journey will be peaceful.
The in-home services that you talk about are they're obviously very people heavy, right? Like the number of people who are required to do that intervention at home is higher. Do you grade that somebody who has more severe dementia is more likely to get more in-home services versus in-clinic services? Is that a way to also look at who needs more in-home versus not?
Yeah, I think a really great question. Really appreciate that question. In fact, rightly you said, I think we started our journey with home-based intervention model. Then later we realized to support the larger number of families, like probably like based on the demand in India, we need so much of manpower, which is from a cost perspective, it's a challenge. So we thought of like integrating technology. Now we are researching on technology. to integrate our intervention model so that we can scale the model across multiple locations, but technology will play a key role. For that, we are developing two products now. One is NeuroBloom and another one is tab-based tool which can help the patient and reach out to our intervention specialist for doing the continuity of sessions through technology or through online, right? So while we scale our model, we thought of making it hybrid rather than completely home based. So for hospital management, we supply a product called NeuroBloom, which is the MVP is already ready, and we deployed in one of the major medical college in Kerala, and we are we are giving to other hospitals also. For the patient, the cognitive tool, I think it's in research right now, and the development is happening from California, and so that is in the work in progress stage right now. So for your question, I think from since the interventions are manpower heavy, so in order to make it scalable, technology will play a key role.
Sometimes I see here there is too much focus on technology and we're moving away from people. So I know it needs to be a mix of both for it to be optimal service delivery.
Absolutely, absolutely. Yeah, without people, things will not work out, especially because since we are managing the dementia people, we only recommend a hybrid model. The person or the human touch should be there, but I think the number of human touch maybe we can reduce and we can scale. One specialist, once the technology is in, I think one employee can manage, I think as per our calculation, 25 to 30 patients, which is a good max. I think when I calculated the P&L.
And this employee is going to the patient's home. Is that correct?
Yes, absolutely. Yes.
Yeah.
The intervention specialist.
Even in the US, if you want to do that well, that number is exactly your 20 to 30. I would say in clinic would be 40 to 50 at most, but in the home, it comes to that. Yes. Okay.
Is the similar model available in US?
It's not really available. The care in the US, dementia space especially, very similar. It's very fragmented care. And in the US, all of it is driven by insurance funding the care. Insurance does not always fund all the different pieces of care that are outside the doctor or the therapist. I'm working on building a similar comprehensive program which does both in clinic, hybrid care, in home care. And I think and also supporting the family, which obviously, I'm sure you're seeing, this is one of the biggest pieces of success
Correct.
here.
Correct.
One of the other things I saw was community intervention model. So,
It's a different process, in fact. When I deep dive, dementia is an umbrella term, as you know, and the reasons for dementia, various reasons. Medical side is also there, but the mental side is also there. What I realized that the majority of the reasons, for this disease, yeah, of course, age-related reasons, then anxiety, loneliness, depression. These are, I think, maybe which we can control. Yeah, of course, ease dementia is easing dementia, but at the same time, we thought after seeing the pain points and deeper challenges what the entire ecosystem is facing, I think we should create awareness to the larger community. We should also give solves to take some proactive steps to avoid this challenge in future. So for that, we did a deep research and we developed a model. So through this community intervention model, we are helping individuals who crossed 55 plus in Cochin city and nearby locations, and helping and improving their cognition. So cognition again, it's a larger term. Under cognition, visual spatial awareness, concentration, eye hand coordination, language. Memory is one of the aspect, right? The similar way, if somebody got demented, I think it's not only memory. I think it is directly linked to cognition, in fact. But that awareness is very very limited in India. I'm not sure about other countries, but I think very very limited. So we thought of taking initiatives to create that awareness among the society, and of course giving some proactive solves by doing community intervention. So community intervention is a model where we invite a group of people, say for example 30 people together, and we are doing the early interventions maybe at the zero stage. Say for example, they may not have any cognitive challenges, but we are creating awareness this disease is there, and probably while you take such kind of steps, so that you can avoid dementia in future. Yeah, so that is community intervention model.
I think you're diagnosing Western medicine or allopathy, which is pretty much what is practiced in India and everywhere. In most places, there is focus on this one thing, one diagnosis, one way to look at it, whereas there are so many other factors that are involved in the patient's wellness, right? It's not just memory. So for Ease Dementia, Cochin area, you're already working on. Are you looking at all of Kerala? Are you looking at all of India and beyond? What is your long-term vision for this?
Yeah, of course, it's not only India. In fact, our vision is to build a world-class brand in the long run. But at the same time, building a brand with give a lot of importance to the culture, building a brand which give a lot of importance to ethics and of course the values what we are driving. Brand is revolving around people who are having memory issues, their family members, and of course the clinical and healthcare ecosystem, right? So values play a key role. Of course, technology play a key role while we scale the brand all over the globe. So I think once NeuroBloom and Cognifit is ready, definitely we will scale our model. Immediate plans is I think Australia and Europe. I think there is huge scope. We just started our initial interactions with some of the clinicians in those locations and maybe replicating the model. And right now we are spread across Kerala and last week we started operations in Bangalore and we are also touching another city called Coimbatore. It's in Tamil Nadu. So within 6 months, I think we will stabilize operations in all these locations. And the next stage is I think parallelly looking out some other countries, specifically Australia. When I did my research, I think it's easy to get access to Australia. And there is huge demand in dementia. I think the good number of patients in that location as well, and across the globe, a good number of patients. But I think in order to get us access, I think probably in Australia may be our choice.
Right. One of the things in the US is that the ecosystem changes from region to region. The population is serving rural to urban changes. Have you found that even within India or even within Kerala, as you're building new branches in different regions of the state or different regions of the country now, are you seeing that you're having to adapt the model or modify it further for that specific area? Are you needing to do that, or it's kind of more easily replicable?
Yeah. So how our model works? I think I will explain a bit about our model, Gauda. We have dementia clinic, I think, across Kerala. Now, I think almost all the hospitals adopted our model, you know. So, in so each dementia clinic means, I think we are giving some solves to that, clinician as well as the hospital management. We developed a couple of conventional tools like elderly workbook, some of the gamification stuff like for the current set of elders, specifically like the 1960s, 1950s, 1940s elders, like what we are managing right now. Apart from that, for the home-based intervention, we have our six-bucket approach, which we developed over the last 3 years, deep research. And of course, to create an impact to the patient as well as the clinician, we have NeuroBloom, which we placed in the clinic, provide or the space provided by the hospital. So we are creating an ecosystem. We are creating an asset-light model where patient can comes into our East Dementia clinic, and we will provide a holistic solution for early screening. And once the doctor decided that the patient is at 0 to moderate stage, we have solves for giving the six-bucket approach at their home, right? And once our technology is ready, we will upgrade our model to an hybrid level so that we can reach to any locations in India through hybrid model. So that's how our model works. Once we reach to rural Kerala, since it's a home-based intervention model, cost is involved. So the biggest question is how do we support the poor families? So for that, the plan is, I think, once our brand complete at least 3 years, we create a foundation, and through 3 years CSR initiatives or probably the grants and all, to support the poor and needy people and support all the people fairly.
So if let's say a neurologist or a psychiatrist or a primary care doctor in a hospital, right, who who is implemented your model, typically that doctor may have been trained in your model, right? So that when they diagnose or come across a new patient, they will refer them directly to your clinic or to your program, and then you take it from there. Is that
Our clinic is already inside in that doctor space, and all the products are displayed there. All the models are displayed there, and they will pass the probably they will pass the information or the brochure or the customer support contact number, and our clinician will also there to support the doctor. So, for example, the clinical psychologist will be ours. Doctor is the decision maker. For us, it's a doctor-led intervention model. And in fact, we support doctors. We are great facilitators, and doctors are the decision makers. So we are creating value to the clinicians. We are creating value to the hospital management. So that's our model. That's how our model works.
I am thinking about what I'm doing very similarly, because the fact is that if you look at the hospital space, look at the doctor space, they see the big gap in care that's existing for the patients, but they don't have the resources. Whereas you, by putting your model and your team right there, you actually have solved the doctor's problems and the patient's problems, which is kind of great. Mm.
That's what we do. And of course, we are bringing technology probably like in the long run, like scale the model across the globe, or probably like maximum wherever like we can reach. And when I deep dive, I think it's a global concern, and I haven't seen a model like what we are doing, at least in India. I'm not sure about other countries, but something like which we are doing is totally unique.
I have not really heard of any other models, and I think the way you're thinking about it is very unique. Just because I think many of the models that I created are thought of very short-sightedly. Oh yeah, we'll diagnose the patient, we'll do this, but there's a lot other part of the system that needs the support for it to work. When you first but when you first came up with this idea, when you first approached the first few hospitals, was that easily acceptable, or did was it harder to sell that idea at that time?
In the initial phase, it was very difficult. In fact, in early 2023, I think like we started in 2023. So when we developed the model, there was only six bucket approach. So at that time, I had a brochure. I had a small presentation about like the six bucket approach, and I connected so many doctors and went to like so many hospitals and tried to convince a lot and travel a lot. It was very difficult in the early stage, but some of the doctors, they had given like few patients, and they ask us like to try the intervention model. So when they had given that patients, and when we applied our intervention model on those patients, I think like doctors started seeing value. We circle back to that doctor with the report, and one of the unique quality of our model is once the patient come to us, every month end, we circle back to the doctor with the report. These are the improvements we could bring, or probably like the improvements may be like for some of the cases very very minimal, but we circle back to the doctor and says that like this is the holistic report like what we can submit like to you, and now we seek your recommendation, or probably like you can advise the family members like on medication management, which is building like a lot of trust, right? So initial phase, yeah, if of course it was not easy, it was very difficult, but I think those who believed in our model, I really like I want to recognize those doctors, some of the good doctors in Cochin, like who believed in us, who believed in our passion, so that was the spirit who help which help us in scaling later.
I mean, other coming from other industry, it may seem closing the loop as being such a simple task, but in healthcare, that is probably one of the biggest gaps. Building trust piece that you talked about, I think is huge. It does not happen in the US at all. Even in big cities, San Diego, I know people send referrals out. You don't know what's going on with it ever. But I think that's the key. And I'm sure in India too, that's tough for the most part. So the fact that you're closing the loop, I think it's really helps keep the doctor know, oh, if I did something, if I put this referral, it actually made a difference. Then it motivates people to keep doing it.
So that is it's not only with the doctor and even with the hospital management, Gaurav. It's with the hospital management also. So because we have a very very strong processes which circles back with the informations to the hospital management as well as the doctors. So that is building trust.
Yeah, there's no way there's no way around building trust. I think that's the key. And I think most people are trying to do things too quickly, but without that piece, it's hard to build something of value. I have the last two questions for you. What other organizations in India today, maybe in dementia or in other spaces, do you feel like are doing innovative work similar to what you're doing?
What I heard is of course like there are so many great institutes like say for example Nimhans is one of the best in India, and there are so many hospitals, but however the 360-degree approach probably like is very very minimal. If I say an hospital may provide the similar quality of home based intervention at any location in India, probably like it may be very difficult, like for them, right? Apart from that, there are a few startups. There is a startup called Ivory. Recently I think, but again, they are majorly focusing on assessments. Again, that 360-degree approach is very very minimal. I think Then there are so many NGOs, supporting, like, say for example, Dementia India Alliance is there, the DIA. So like, because we are also part of DIA, and they are taking like a lot of initiatives, like in formulating the policy with the government in India. Great initiatives they are doing, in terms of building the ecosystem and formulating the policy. What some of the patients and family members are like seeking support from the. So these are some of the things like which is happening in India as of now, as per my understanding. And I think like the scope with us is probably like the 360-degree solve, probably like a very very I haven't seen any organization like focusing in that manner.
I mean, it is very different, and I have not either, even here in the US, because I think that kind of complete hand holding and closing the loop just for the patient, the family, and also the medical care team is very different. And it seems simple and practical, but it is not done in most places.
Yeah, right.
Let me ask you the last question. So, what is the most exciting or challenging problem you're working on today?
The challenging problem, I think there's so many problems every day. It's a challenge, like as far as the startup is concerned.
Right.
Right, I think because every day it's a challenge, right? I think like every day new problems, new challenges. And I think like once I deep dive into the problem, I think I realized a huge scope everywhere, huge scope in improving the processes, scope in touching people. I think like huge scope in creating an impact. It's there. um yeah, one of the challenging problem probably like the technical solve. I think to build two great products. Right now Neurobloom MVP is ready, but however, how can I build Neurobloom to meet the vision what we have. I'm seeing in my mind. I think like which I need to passionately work along with my tech team and getting it ready for helping the larger need of the society. And apart from that, the cognifit. These are the two challenges. Like right now, I am focusing. In fact, the focus, the processes, six bucket approach, scaling the operations. I think right now things are moving smoothly. The operation scaling is moving smoothly. We are getting like a lot of recognitions, and every hospital management is recognizing us, at least in Kerala. Everywhere like we are almost spread, but scaling into other cities, that is also a challenge, because we just started focusing on Bangalore and Coimbatore. And I think like India is a huge space, so definitely at least like we should reach to tier 1 cities, and at least in next 18 to 24 months, at least like the major tier 1 cities in India, at least like we should have that space. And so that's these are some of the things like which I am working right now.
I'll actually be in Bangalore in June, and hopefully I'll see if I can visit one of your new centers there.
Definitely, Gaurav. Yeah, yeah. And if you're coming to Bangalore, like why can't you visit Cochin also? I think probably I think like
I
then
will. I
our
will.
core infrastructure is based out in Cochin, one of the metro station. Again, that itself is a innovation. From an India perspective, and proudly I can say why we created our neurocognitive clinic and infrastructure in a metro station. People can easily accessible, specifically elders can easily accessible through metro.
No, no, it's really fascinating. I think the work you're doing is, I know it has meaning for patients, for medical professionals, and the teams. But I know, even from me who enjoys building programs and enjoys like thinking about health system work, I think what you're doing is very exciting. So I appreciate you. I'll definitely try my best to visit you in Cochin, and I
Yeah,
appreciate you taking the time today. Thank you so
yeah. And
much.
thank you so much. Thank you so much, Gaurav. Thank you.
Right.